who, yes. So as you all may remember, at our very first meeting, we are at our very first meeting of the Governor's Advisory Council of Racial Justice, we heard from the governor that she said that she was going to really focus on creating racism as a public health crisis, using the Department of Health to do that. She let us know that that was not something that we needed to personally take on. I know that many of you were interested in that as, you know, one of the things that the council would do. And so there have been several different community groups, the Deconstructing Racism Committee, the New Mexico Public Health Association, and other people throughout New Mexico who have really been working on this issue and have been giving the Department of Health some feedback. And so now they have moved to a place where they have the public health crisis. It's not an order, but Dr. Parajon will tell us more about that. They have formulated it, they have connected it to the work that they're doing and the mission that they have. And so we are going to hear from them tonight on all of that and be able to give them some feedback on what they have created and any ideas or thoughts that they have about, or that you all have for them for moving forward. So I want to introduce Dr. Parajon, who is the Deputy Secretary of the Department of Health. And I'm going to turn it over to her. Do you want me to go ahead and share the PowerPoint screen? Okay, great. So I'm going to share the PowerPoint. You also have this. I emailed it to you all earlier this week. So if you are wanting to follow along, not by the screen, but by what you have in your email. So Dr. Parajon, we will turn it over to you and take it away.
Okay, great. Thanks so much, Amy. And please feel free to call me Laura. And I'm just really grateful to be here with all of you. This was a process that we did, I think initially it was started in December of 2020, I believe. Is that correct, Amy? And then what happened was during the pandemic, it was hard for us to, do anything but the pandemic issues and vaccines and all the work around that. So what we did was recently in February, we went back to the documents, especially the ones that were developed by, I think Christopher Ramirez is here from the Deconstructing Racism group, and a lot of the other work that other people have done. And we saw like, what were the to-do lists, after the whereases, what were the actions that people were wanting, Department of Health to take a lead on, as well as, working together with others. But what we thought was say, well, why don't we try to look at all the to-dos on that list and think about how we can integrate them to things that Department of Health also needed to do in order to have more accountability on the Department of Health end, and also as state agencies saying, what can we do to address structural racism as a public health crisis? So, and please feel free to ask questions. We just kind of sort of put this together so that people could respond to it, and it's really based off the other document that was worked on, and NMPHA worked on it, as well as Deconstructing Racism team, and then your health subcommittee as well. Next slide. And we had been working on the health subcommittee prior to this because of the vaccine equity issues and making sure we're trying to get out the vaccine to populations around the state that were being less vaccinated. So what we wanted to do on the Declaration of Racism as a Public Health Crisis was really try to make sure that it wasn't a document that was just saying this is a crisis, but actually hold us accountable and others accountable to actually taking action to ensure the best conditions for all New Mexicans to achieve the best health possible. The key components of the declaration really include an acknowledgement first that structural racism is a fundamental cause of health inequities, and then recognition of the leadership role of public health efforts and other efforts to eliminate racism and achieve optimal health for all. Like, what is the role of all of us in this? And then we had several actions that were like you can clump together in groups. Like first was leading organizational change efforts to update our public health infrastructure and do a health equity in all approach, both internally within DOH and externally with other government agencies and partners. So recognizing that, the Department of Health internally also, had some work to do, and then also like how we relate to others. The next piece was really seeking and allocating resources for engaging in access to address structural racism. Sorry, that was a little error there. So, looking for those resources to make sure that it wasn't just, just a declaration, but actually having resources to do that. Using CDC's has a 10 essential services framework for public health, of which equity and anti-racism work is at the core of that. And that was recently updated in 2020. So we're taking those, updated essential services and applying it to this work. Also recognizing Indigenous knowledge as an equity framework to really implement concrete policies, procedures, and practices for addressing structural racism, promoting health equity, and achieving optimal health for all. So that's kind of like the overview of this declaration. Does anyone have any questions or want to comment on any pieces of this? Okay. All right, so on the next slide, if no one has that, we tried to make sure that the declaration was built on the partnerships and community-led solutions that many of you had already participated in. We didn't want to not take into account everything that has already been done. So, the partnership piece we feel is really, really critical. Deconstructing Racism New Mexico connected with coalition partners, held meetings, built relationships, conducted research to build the basis of this declaration. So what we did was really take what they had, like I shared, and just, put it inside a framework that would hold us more accountable. We also were really grateful for all the people who contributed to the writing of this declaration, and that includes a whole list that you see here. Next slide. And then this is just kind of what we try to do, is just try to put it into like a framework so that when we can talk to the governor's office and others, we can see how it would affect a family. So we just shared the story of one family, and you can read it here, but just saying Maria is a pregnant single mom, lives with her 8-year-old daughter Martita and her mother Socorro in a 1-bedroom apartment in the International District. Her employment, she works long hours as a server in a Mexican restaurant at minimum wage. Rents have increased, so she can't afford living on her own. Maria wants Martita to get vaccinated, but can't take time off and lacks transportation to the few vaccine sites available. And then, and we kind of framed it within COVID just because it's a composite of people that we've been working with in the department that, we've served. Maria had COVID once and wants a booster, but because of rumors, isn't sure if she has to pay for the booster. Maria dreamed of becoming a nurse and having a small home for her family, but after her dad died in an accident, the family lost its car and his income. And then her stressor, she struggles to pay the bills, find transportation, worries about crime in her neighborhood, having enough to eat each month. And while she's grateful for Medicaid, it can take a full day to get the services, and she's always worried that the services will be pulled back. So just an example of a person that, like I said, a composite of people we've served, to try to then break out, like, how does this relate? How does structural racism and its impacts affect someone like Maria? Next slide. And then one of the newest things we've done at the Department of Health is that we recently updated our mission and vision so that health equity is in the mission of the New Mexico Department of Health. And just starting with ensuring health equity, we work with our partners like yourselves to promote health and well-being and improve health outcomes for all people in New Mexico. And we know we're not quite there yet, but we're really using this as a guide to say, how can we have more of an equity framework and lens in our work? This includes expanding equitable access to services, improving the health status of all New Mexicans, and ensuring safety in New Mexican healthcare environments, and as well as trying to support each other, building the pipeline for the Department of Health from people who are from communities of color, people with lived experience. Next slide. And then this is just, and you know what, Amy, if it's okay, I'm just going to go through these quickly so that we can have a lot more time for, response. But this is just one of the slides that we have to show, like, what's the difference between inequality, equality, equity, and justice, and using the Giving Tree slide to show that. Next slide. And I know, like, we're talking to the choir here. Basically, each of these slides have to do with the whereases in the declaration. So, like, they're matched with the whereases. So one of the whereases is about seeking to align efforts to achieve health equity with core cultural values. So that's where this whereas comes from in the document that you may have here. Next slide. This is the document that's, talks about New Mexico being diverse and multiracial state and communities of color being the majority. Next slide. This is the other whereas that talks about leading with race and racism, and really talking about why race and racism matter, and how the different levels, structural racism, institutional racism, racial equity, and health equities are created when we do think about racism. Next slide. And then, we have another whereas that talks about how structural racism really overrides past and current policies, practices, norms, and values, resulting in poverty, power imbalances, discrimination, lack of quality education and housing, lack of access to basic health care. Next slide. And we're really, like, setting it up so that, we can really talk about how we're addressing these different pieces, including the root causes of health inequities, being structural and intergenerational, the genocide, the slavery, 100 years of legal segregation and displacements, land and knowledge loss, then recent history of discriminatory policies and housing, voting, employment. And all of these are, like, part of the whereases, the root causes that are the current housing overcrowding, the things that are impacting on health inequities. Next slide. And then also, like, kind of part of this is just, like, a presentation to the governor's office so that we can, like, kind of build the case, and understanding that, like, racism is an iceberg, and structural racism is the hidden base, so that maybe sometimes we just see the individual level health outcomes, but we don't realize that underneath it is all the population level health outcomes. Next slide. And then, then, like, what we often think of, what everyone always talks about is the inequitable conditions of the social determinants of health, but we try to also build in what are the root causes that contribute to these 80% of health outcomes. Next slide. And then we just share, like, kind of from one of the articles that we had about how structural racism damages health, and all the different pieces that end up making, the outcome that there's worse health among people of color due to these health inequities, and all the little levels that, go towards damaging health. Next slide. And then, then we have a set of slide deck and a set of kind of whereases that says, how do race and racism affect Maria and her family's outcomes, as an example. Next slide. And so then, then the next series of slides is all the different slides that are building the case for showing that inequitable community conditions create inequitable health outcomes. So the impact of negative social, economic, and environmental conditions harm the health of residents of color. And then we go through, like, life expectancy, low birth weight, premature deaths, and diabetes as a overall global data set. Next slide. And then just, the next series of slides is all the ones that basically show, this is from our recent health status that our epidemiology response division team put together, but, more American Indian, Black, and Hispanic with fair or poor general health status compared to white populations. Next slide. you know, higher rates of obesity. Next slide. And just, you know, just keep on going with like the different, you know, final outcomes due to racism. So smoking is higher in African American and Hispanic populations. Next slide. Higher rates of diabetes compared to white populations. Next slide. Also higher rates of low birth weight babies compared to white babies. Next slide. And I'm going through these quickly just because they're just trying to build the case here for the document. And then also higher rates of years lost before the age of 75. Next slide. And then also in New Mexico, American Indian Black mothers die in childbirth at higher rates as well. Next slide. And then just examples of how COVID exposed these health inequities even more starkly. So here's the next series. So this just shows how American Indians in New Mexico are 4 times more likely to be hospitalized. Hispanic and Latinos are 2 times more likely to be hospitalized. Next slide. Also, people of color have the highest case rates of COVID. Next slide. And also have the highest rates of death in New Mexico is from American Indian and Hispanic population, as well as African American populations. Next slide. And then also a higher number of people dying from younger age groups in American Indian, Hispanic, and Black populations. And you can see that here as well. Next slide. And then, you know, oh, sorry, that's a repeat slide. Sorry about that. We can take that out. And then also higher rates of tobacco use in Black and Hispanic populations. Next slide. And so the idea is what has New Mexico's government and the DOH specifically done to try to address structural racism and health equity? And like I said, we're just at the beginning of this journey. We know we're not there yet, but we want to use this declaration as a way to move towards that, a better space regarding structural racism. Next slide. So if you can see here, this slide shows that, you know, while initially COVID-19 disproportionately affected American Indian populations for hospitalizations and deaths. So you can see that in the black line here. But the really amazing vaccine and prevention efforts done by the American Indian population, Navajo Nation, and IHS actually really decreased death rates here and hospitalizations. This is a hospitalization graphic that shows that initially you see a really high rate of hospital admissions, but that kind of keeps on going down throughout the pandemic. And then especially after vaccination really starts to go down compared to other groups. Next slide. Also, New Mexico had some equity bills done that also address structural racism. So the governor and the legislature passed several bills that help with eliminating structural racism. So the constitutional amendment providing early childhood education supported by the Land Grant Permanent Fund, College for All, cleanup of Superfund sites that are disproportionately located among communities of color, and also support for the COVID-19 equity response. Next slide. So what we did was really try to say, you know, here's an example of what we did during the COVID response to really have a community-based model to address structural racism. So what we did during the COVID response was, you know, we had funding from the CDC. We were able to work with our community partners, including many of you here, to plan and execute policies for equitable distribution of the vaccine and testing through really getting mobile units with initial allocation to high areas with high social vulnerability that were most impacted, really engaging the community to work with trusted messengers, including community health workers from diverse populations and communities, and got the CHW workforce support, democratizing data and evaluation. So we really collected and shared and utilized disaggregated data by race and ethnicity to inform the COVID-19 efforts, and then really do some like innovative communications to give different resources in multiple language with feedback, partner with communities and other state agencies, and really build to really enhance distribution of the vaccine. And through this money that we got from the CDC, we really did provide funding for community health councils and different community orgs to to be able to determine their own local priorities around COVID and respond to identified needs. Next slide. So we thought, while COVID was like an X-ray that exposed existing health and racial inequities, we have some tools to address structural racism that emerged from these COVID innovations. Next slide. And so what we did was say, okay, while structural racism is a root cause of health inequities across centuries and generations, inequitable structures and systems can be transformed by partnering with the most impacted communities. So what we tried to do is we worked with all the different groups in the subcommittee and others to really say, how do we want to do this to improve the health and well-being of people, looking at downstream issues like physical and mental health, social and spiritual well-being on the left-hand side. So what are the things we need to do to have thriving people? But also on the right-hand side, what do we need to do to improve the health and well-being of places and people? So looking upstream to look at those, community conditions like food, housing, and work, but also root causes like fostering community power, transforming inequitable policies and systems to equitable ones. So really saying, let's look at the whole picture and see what we can do to build equity and eliminate structural racism. Next slide. And so, so that's what this whole declaration tries to do, is try to set the stage for this kind of work. Next slide. And so, just saying we need to be financially responsible and address structural racism, right? In general, public health infrastructure has been historically underfunded, as well as equity efforts, and the lack of funding and accountability has resulted in continuing health inequities, and then that direct impact on, Department of Health, the people who use the Department of Health. So we want to try to then say, let's use the money to improve health and well-being through community partnerships. Next slide. And so we use this 10 essential services. It's a CDC framework that basically says, you can look at public health and say to protect and promote the health of all people and communities, you have 10 essential functions that provide a framework. And to achieve equity, these services really actively promote policies, systems, and overall community conditions that enable optimal health for all and seek to remove systemic and structural barriers that result in health inequities. Barriers like poverty, racism, gender discrimination, ableism, and other forms of oppression, and that everyone should have a fair and just opportunity to have optimal health and well-being. So if you look at each of these public services, essential public health services, they're embedded in the to-do list, the to-do action list of this declaration. Next slide. And then aligning actions for addressing structural racism and health equity with the CDC essential services. So these are things, so once again, thanks to the team that put this together and the community and worked with us so much to do this, but for data and evaluation, assuring that we have a racial equity lens to all aspects of data collection and utilization. For communications, having linguistically and inclusive communications to build trust and address equity. For community engagement and partnerships, strengthening, supporting, and mobilizing disproportionately impacted communities to develop public health solutions. Under the planning and policy, these are all the different essential services. Under planning and policies, create, champion, and implement health equity in all policies by working with multi-sector partners and communities. In the workforce pipeline, build and support a diverse, skilled public health workforce reflecting the most impacted communities. And then the last, workforce development, identify and implement evidence-based workplace strategies, training, and initiatives to address structural racism. Next slide. And so the previous slide basically that's all the key to-dos that are in the document. And then this one just says, if we can do all these things together, tomorrow, like the Madrigal family, with a strong focus of equity, with resources, staff, and strong multi-sector and community partnerships, the Department of Health and other departments are working towards addressing structural racism and providing fair and just opportunity for all to reach optimal health. And next slide. So, basically in this setting, Maria, Socorro, Martita, through different work of different groups, now live in a subsidized apartment in the International District. The local data can improve Maria's access. So the DOH and other partners now work with community partners and CHWs to evaluate programs and policies that address the root causes of structural racism. In the International District, many DOH staff have roots in and live and work in that community. And Maria is close to a local office that has evening and weekend hours to accommodate her schedule. In terms of her employment and income, she still works as a server, but she's making a living wage and has more time with her family. In terms of COVID, she's able to get a booster and take Martita to her vaccinations with paid time off, and the small business is reimbursed for giving workers time off for vaccination. Maria's education dream is supported. She is now taking a course to become a community health worker. And while she still has many challenges, her family is healthier and more secure. She has help from a community health worker to deal with Medicaid and other social services, as well as maternity doula to access contraception and other family services. So that's like the big picture. Sorry it took so long. There's a lot of pieces to this, but we just wanted to share it. And, we don't necessarily want to take ownership of it, like in the sense of like, oh, this was a group project. We all worked together with many, many people on it. But in terms of implementation and getting funding for it, CDC has given us some funding for the health through a health disparities grant to do some of these things already. And we felt like the declaration would really be able to say, let's hold us accountable to this, as a state agency, but working in partnership with all of you, and then build it together. We haven't put together on the last part of the, Amy, could you just share the declaration? On the last part of the declaration, it has a racial equity plan as part of this work. So we would love to work with all of you to try to build that racial equity action plan. So that's kind of where we are. Here's like, if you can see this document, all of these, the PowerPoint slides were really to back up each of these whereases. And then if you go down below on the action items, I hereby direct as follows. Each of these hereby direct as follows items are linked to the PowerPoint in terms of the action items. And the very last one is, yes, hold on. The last one is to develop a racial equity action plan. And there's also another opportunity right now that will help us build a racial equity action plan, is that through the Association of State and Territorial Health Officers, it's called ASTO, they have a policy opportunity to have a multi-sector group to work together on the racial equity action plan and see what other states are doing as well to try to, it's a eliminating structural racism policy academy that we also currently have the opportunity to participate in. So that's the big picture. And it's, written into the declaration. The PowerPoint just kind of shares, how it was developed and the pieces that went into it. And I don't know who else was here from our team, but I can't really see. But there were, like you saw from that first list, we have had an amazing group of people working on this, and we wanted to share it with all of you. And I'm going to turn it back over to Amy. I was just going to give the big picture of how all this work came to be.
So we already have a question. I'm going to read it out loud, but you can also look at it by clicking the Q&A at the bottom of the screen. It is from Nancy Lopez. It says, thank you for your leadership. Does New Mexico Department of Health collect educational attainment as baseline equity metric for intersectional analysis? One challenge or opportunity is improving our data infrastructure for distribution of resources to go beyond disaggregated data and engage intersectionality as inquiry and praxis. For example, considering the simultaneous simultaneity and historical context of structural oppression, resistance, race, gender, class, origin, citizenship, status, sexuality, etc. How can we create equity metrics and accountability for distribution of resources that engages intersectionality? For a JAMA article on COVID-19 mortality that considers the simultaneity of race, gender, and educational attainment, see the article by Feldman and Bassett, and she put a link there for that.
Wow, thank you, Nancy. Thank you for all that. I think this is where we do want to like work with people like yourselves, Nancy, and others to say, because we don't have the perfect equity metrics right now. I'm not sure if we do that intersectional data analysis at this point. I think we could, but I think that that's one place where we would love to like work with all of you to say, especially Nancy and all your work, that would be a great thing to really look at. I'm tracking your stuff. I just copy and pasted the questions so that I can look that up and check in with our data team. But right now we are forming a data team at the Department of Health to really try to look at some of this data, like an equity evaluation team to really look at these measures. So we would love to reach out to you, see how we can work with you as well, and others who have other ideas on how to get better data on intersectionality and how all these things work together, and then the concrete piece of how do we address these issues. So thank you. Okay, so yes, I'm not sure. Yeah, and I'm not sure, Nancy, but yeah, if it is not collected, then that's something we can start looking at. And I haven't used, to be honest, I haven't used the educational attainment measures at this point in time. So if they're not collecting it, I would have to check. But thank you for mentioning that, and it's something we can look at.
Dr. Patel, I see your hand up. Did you have a question?
I did. Thank you, Amy. And thank you, Dr. Barrajon. It's always great to hear from you. And it's so great to see your work at the Department of Health. My question is, what is your sense of, oftentimes when we think about structure at the high level and at local levels, we are limited by resource constraints. And what is your sense of, are we able to achieve our goal, these action items and goals in a attainable way without, needing enormous external sources of resources that we may not be able to have at our fingertips? And for example, a lot of our COVID related funds, for example, came from allocations that were one time and they're not going to continue. What is your sense of what those action items look like, and or is this declaration more of a kind of setting the stage for figuring out what actual structural changes we will need to implement going forward?
Oh, thanks so much. Good to see you too. Yeah, I think that one of the things we are trying to do is say, let's take the money we have right now. So we did put a huge chunk of the CDC funding that we got into communities, like I shared, giving communities funding for the health councils, giving funding to communities to actually have grants to address COVID issues, just because that's where the money came from. But because we were able to do that, we're like, hey, why don't we try to think about how to structure things at the Department of Health, and also use ourselves as an example for other 8 state agencies to say, maybe what we need to do is not just rely on these external funds, but actually ask for ongoing funds for some of these issues that are really important. Like, so for instance, the data that Nancy is talking about and what current data that we're collecting, a lot of that data needs to get back to communities, right? Needs to get back to the people. But the problem is that we often just have just enough staff to get enough money, like just to have enough staff to just like actually put out this report, but we don't have all the staffing that's needing to say, hey, we need staff in the communities, we need people from the communities being paid also to work on these issues, and just trying to understand what do we need in order for us to have to actually structurally do this as well, the human resources, the staff. So we would like to say, hey, how can we work together as a team to, you know, ask for legislative funds, ask for ongoing funds for this, and not just rely on the external funding that we've currently gotten. But you know, COVID was both a blessing and a curse, right? Obviously, it was terrible how COVID has affected our communities of color, but it also gave us funding to do some of this work, to say, yeah, it can be done. We just need the resources to do this work. Does that make sense? But so I do think it's a multi-pronged effort of all of us here and others to come to band together to say, yeah, we do need this funding, you know, to continue this work. So does that answer your question?
Yes, thank you so much. I appreciate that.
Thanks.
And Dr. Lopez put the full citation for the article that she mentioned earlier into the Q&A. Are there anyone else that has questions or comments regarding her presentation or the declaration? Dr. Romero, please.
Thank you. Thank you for that wonderful presentation. This is exciting. I guess a couple of questions. I'm thinking about how this is going to play out and affect in the public school side and the higher ed side, and a couple of things come to mind. You know, one is we are right in the middle of starting to implement new social study standards. That's caused quite a buzz around the state, depending on where you're at or who you're talking to. Also talking about higher ed side, really starting to increase and fully develop our ethnic study programs. And so I guess my question is, when do you see this coming out? What is the rollout going to look like, the timelines? And I think if I can, in my world, if I can think about how I can align some of the efforts going on in this other part and help use this to be able to support that, that could be a good thing.
Yeah, no, that's so great. Thank you so much, Dr. Romero. I would, you know, I think we have talked about this. We help to work together on it, but we feel like, you know, if the governor's council would be the ones to push this forward, we think it would have a lot more ability to pass and get forward, because you know, and that's why we brought it to you guys today to share it, because I think that at the end of the day, you know, this is the work of everybody. And so if we could say, this is what you guys are putting forward, right, with our support, like DOH supports it 100%, we think it would have a better opportunity. And I think Amy could explain that better, just because of the history of your council. We think that would play forward, and we really look forward to trying to work more closely with all of you, and just trying to say, you know, we're new at this too, right? We're not, you know, this hasn't been done as a statewide effort. And I think that working with all of you, I think gives it more of a global, or I don't know, Amy can explain it better, but like, you know, you're the Governor's Council on Racial Justice, you know, we're the Department of Health, we're a state agency. So we think that one of the ways you guys can help and move this forward is that if this is coming from the council and not necessarily from the Department of Health. And like I said, we support it 100%, just thinking that probably that would be the way to do this. And then working towards a cross-sector effort to really push this forward, right? Multiple state agencies supporting this. We think that really in order for the state to actually address this, it shouldn't just be DOH, right? And you guys are more cross-sector than we are. So that's what we were thinking. But Amy, do you want to build upon that?
Yeah, I think, that's really our role as is to be
Mhm.
able to make a recommendation. And so what we'd love to do at the end of today, if we have enough support from you all, is to really be able to say that as a council, we recommend that the Department of Health moves this forward. And of course, as always, we would create a letter to be able to pass that forward. We would write that letter to both the governor's office and the Department of Health, so that as the Department of Health presents this to the governor's office, that they have, us as a recommender, and then also that the governor's office, can connect this to that very initial promise that we had from that very first meeting, where the governor had this on her mind and on her agenda as well. Timing wise, right, that always becomes kind of the question is, the way that our sessions go and the way that projects go and things like that, we really can't say what the timing wise of it is. But I think that the beauty of the way that the community members and the Department of Health created this declaration is that they connected it to part of what the Department of Health is already being held responsible to. And we're able to really put a racial justice lens on that. And so I think that even without the declaration, and because DOH supports it and we really want to see it move forward as well, we still want to move forward with a declaration. And at the same time, it doesn't mean that those action items don't have to be something that we can also look at individually, and not just looking at the declaration. Any other comments or questions? I also, Christopher is in our audience and I wanted to put him on the spot a little bit. He is leading the Deconstructing Racism Council. He has been a huge part of creating this. And Christopher, I just, would you be interested in speaking to the value of us putting this forward as a recommendation? Oh, sorry, you can't. There you go.
Yeah, Amy, thank you so much. And Laura, I just want to give a lot of kudos. Laura was an incredible asset, you might know. And Amy, I don't know if you remember, we actually started working on this as Deconstructing Racism New Mexico back in 2018, talking about it, and then doing our own research in 2019. And so to be able to work with a champion, and I've often said this, right? Laura, who some of you know, was really leading some of our COVID pandemic efforts to also do this, shows her commitment to racial justice and New Mexico communities. And then just want to lift up, I think I'm really excited for the opportunity for New Mexico to be a leader in moving forward with these kinds of declarations that are also based in, we really talked about how it's rooted in the summer of 2020 and Black Lives Matter, George Floyd, and other, right, anti-Black, unfortunately, violence that happened in our communities, but also Indigenous, right? That real important asset we have in New Mexico, our Indigenous knowledge and ways of being and knowing that I think are really going to be incredible tools, right, Laura, as we move forward, that we have for public health, but also for the other state agencies. So I'm excited, Dr. Romero, to continue to work with people like yourself on the education side. I want to also say, as a leader around environmental justice and transportation issues, I'm excited to say, hey, New Mexico Department of Transportation, hey, Department of Environment, we're gonna let's take this to the next level and get other state agencies also, right, Amy, and others to follow the lead. And this is what's really exciting. We have, just like we've been saying, all those of us on this council, including the members like myself of the subcommittees, and then others, have this incredible opportunity that Laura is now asking for folks to engage, right, Laura, to implement this collectively. And so I'm just excited about what that means for authentic community engagement. And I'm excited for the council to support this because, you know, it's one thing for Dr. Scrace to issue a public health order, like Laura was saying. It's another thing for the governor to say, you know what, let's do this as right. The governor can actually do a lot from her office, right, to make a bigger impact in our state using this tool as well. Thank you, Amy, for giving me a chance just to speak to why this is such an important issue for the council and the subcommittees.
Great, thank you. So I don't see any other questions. If there are other questions, we can certainly bring those forward still. Our duty right now is to really think about, do we want to move forward in creating a recommendation for the Department of Health to issue this and give them a letter that they can take to the governor's office when they present it. I think what we're looking for is hands up. If you can use the thing at the bottom that says raise hand, or if I can see your hand, wonderful. Awesome, okay. So as always, it looks like we've got a lot of hands up, so I'm gonna hear that as a yes. Let's move forward. As always, we try to, create a letter to really, rather than just saying, yes, we agree, really create a letter that says what we wanna do. Are there folks that wanna volunteer to be a part of that process? 2, 3 people at the max is what we'd really like to have. I still see hands up, but I think that was your vote to say yes, so. Okay, because we have agreement from you all, what I'm gonna do is I'm gonna go ahead and put together a letter, send it out to the whole group, and maybe we can just kind of email some thoughts and any kind of edits and corrections and new thoughts that you have. Thank you, Christopher. And so Christopher and I will work on that together, and then we will send it out to you all as a group. Normally we have such a quick turnaround on these things that we have to get things done in 2 to 3 days. But I think we have a little bit more time for this one because we don't have time with the governor's office scheduled to present this yet, but that will come very shortly. So we want to do a quick turnaround as much as possible with this one as well. So that is our agenda items for today. I want to thank you all for being here. I will see you all for our May meeting, and please enjoy as the weather gets warmer. Enjoy all of the wonderful graduations that are coming up. Let's celebrate all of those amazing scholars that we have here in New Mexico and talk to them about the wonderful, innovative things that they can do here in New Mexico and keep our scholars here avoiding the brain drain, right? Thank you guys. Have a great week.
You too.
Thank you so much.